lockdown when you depend on your daily labor to eat. News reports from around the world describe how many people are in danger of being left without access to food. Meanwhile, schools have closed for an estimated 1.4 billion children. This has halted their education, opened some to increased risk of abuse, and deprived many children of their primary source of food. As I have said many times, physical distancing restrictions are only part of the equation, and there are many other basic public health measures that need to be put in place. We also call on all countries to ensure that where stay-at-home measures are used, they must not be at the expense of human rights. Each government must assess their situation while protecting all their citizens, and especially the most vulnerable. To support countries in making these decisions, WHO will tomorrow be publishing its updated strategic advice. The new strategy summarizes what we have learned and charts the way forward. It includes 6 criteria for countries as they consider lifting restrictions. First, that transmission is controlled. Second, that health system capacities are in place to detect, test, isolate, and treat every case and trace every contact. Third, that outbreak risks are minimized in special settings like health facilities and nursing homes. Fourth, that preventive measures are in place in workplaces, schools, and other places where it's essential for people to go. Fifth, that importation risks can be managed. And sixth, that communities are fully educated, engaged, and empowered to adjust to the new norm. Every country should be implementing a comprehensive set of measures to slow down transmission and save lives, with the aim of reaching a steady state of low level or no transmission. Countries must balance between measures that address the mortality caused by COVID-19 and from other diseases due to overwhelmed health systems, as well as the social economic impacts. As the pandemic has spread, its public health and socio-economic impacts have been profound and have disproportionately affected the vulnerable. Many populations have already experienced a lack of access to routine, essential health services. Our global connectedness means the risk of reintroduction and resurgence of the disease will continue. Ultimately, the development and delivery of a safe and effective vaccine will be needed to fully interrupt transmission. Finally, I would like to thank the United Kingdom for its generous contribution of £200,000 to the global response to COVID-19. And I would appreciate also the Prime Minister for his leadership and generosity. We greatly appreciate this demonstration of global solidarity. In an editorial last week, development ministers from the UK, Denmark, Iceland, Finland, Germany, Norway, and Sweden calling on all countries to join this common endeavor. They said that tackling this disease together is our only option. I couldn't agree more. The way forward is solidarity. The rule of the game is solidarity. Solidarity at the national level and solidarity at the global level. I thank you.
Thank you very much, Dr. Tadros, for these opening remarks. We will open the floor to questions. We will ask journalists to be short and ask only one question, so we try to get as many as possible. And we will start, if possible, with Jamil. And we just need a second to get our lines on. Jamil, can you hear us now?
Yes, can you hear me?
Yes, now it's okay. Jamil, please go ahead.
Thank you, sir. This is Jamil Shader from UOL, Brazil. Dr. Tedros, what is your position, and especially in this new strategy by WHO regarding chloroquine? What is the evaluation WHO has on this medicament? Is it supposed to be used? Is it not supposed to be used? Do you recommend? Do you not recommend? Where are we in this issue? Thank you so much.
Yeah, thank you. Thank you so much. Before I pass this to Mike, I would like to say a few words. First of all, correction, the generous support from the United Kingdom is 200 million pounds. And I'm glad also that the Prime Minister has recovered and is back home. And we wish him well. And I would like to appreciate him and his government and the people of United Kingdom for their generosity. Thank you. Mike.
Thank you, Tedros. The question was regarding the chloroquine, yes, indeed. Sorry about that. The issue with chloroquine is chloroquine and hydroxychloroquine are licensed medications all over the world for a large number of indications, and in many cases are life-saving. And many patients with very difficult and chronic conditions are managed and have good lives in taking that drug. The initial and some initial indications that the drug may have some use in the treatment of coronavirus, of infections, and specifically COVID-19. And in fact, those drugs have been introduced to WHO's collaborations on trials under the Solidarity trials and also under the Discovery trials and other trials all over the world. So the medical and research community are really taking the potential of hydrochloroquine seriously, and chloroquine seriously, and it's currently, as I said, involved in a number of different trials. Some countries have issued guidance to clinicians that allows a clinician, in the case treating a patient, to use hydrochloroquine or chloroquine in an off-label mechanism. That means they may, under the current licensing of the vaccine, choose to use that in the care of a patient with COVID-19. There is no empirical evidence, there is no evidence from randomized controlled trials that it works, and clinicians have also been cautioned to look out for side effects of the drug to ensure that first we do no harm. We eagerly await the outcome of the trials that are underway, and Maria may have more details on that.
Okay, thank you very much. Thank you very much. So we will go to India today. It's Amit Kumar, if I'm not mistaken. Ankit.
Hi, my name is Ankit Kumar. I represent India today. My question is, an Indian province had placed an order of 500,000 rapid antibody test kits from China for the purpose of mass community testing. Now, Indian local authorities are telling us that only days before the delivery, they have been told that those kits meant for community testing in India have now been diverted to the United States, a country which is already testing more people per million than any other country on the planet. Have you received any communication from Indian government regarding such issues? As a global body, where do you stand on such issues? What can WHO possibly do in such a scenario? Thank you.
To my knowledge, we've received no such communication on this incident, but there is, in general, around the world, a lot of pressure on supplies of diagnostics, a lot of pressure on supplies of protective equipment and other essential supplies. And it is really important that everyone remains disciplined in this process, and that we don't allow a market that's already failing to fail entirely. Now, in that regard, WHO, and the Director General announced it on Friday, has been working over the last months with other agencies inside the United Nations and other multilateral organisations to create a global supply chain process, a task force that tries to bring together procurement, allocation and supplies around a set of essential products like diagnostics, protective gear, oxygen supplies and ventilators and other important support equipment. We have produced a global catalogue for that equipment and are endeavouring to work with our partner agencies and donors to do bulk purchasing of that material in order to distribute that in a more equitable way around the world. But that doesn't fix the market problem. That could allow us to ensure that all countries get a minimum supply of essential goods or essential supplies, but it in no way can fix what is a global failure in markets and competition between countries, whatever those countries are. Our competition within countries, for that matter, for materials, only drives prices up and leaves a situation where people who need stuff may be without it. But I'm not aware of the particular incident that you referred to.
And I just would like to add to what Mike said. There is overall a shortage of supplies globally, be it test kits or PPE. And that's why we're trying to do what Mike said, which may not address the shortage. And at the same time, we're working with the private sector and with the International Chamber of Commerce and around 3 areas. One is to increase production. Second is to address the cross-border trade problems. And third, equitable distribution. So we'll continue working to address the root causes of the supply problems.
Thank you very much, Dr. Ryan and Dr. Tedros. We will now go to Reid Wilson from The Hill. Reid, can you hear us?
I can. Thank you for taking my question. There are reports that President Trump may cut off funding for WHO this week. What would that do to the agency's budget? How would it impact the response to COVID-19? And can you talk more broadly about the relationship between WHO and the United States?
As you know, the United States is actually the largest contributor to WHO. And I have met President Trump a number of times before, starting from 2017. And recently, we had a call conversation 2 weeks ago. And what I know is that he's supportive, and I hope the funding to WHO will continue. And the relationship we have is very good, and we hope that this will continue.
Thank you very much. Let's go to Agence France Presse, Nina Larsson. Nina, can you hear us?
Yeah. Hi, thank you for taking my question. A lot of people who get sick from COVID-19 appear to show symptoms in waves where they appear to get better only to get sick again. Could you say whether or not it's been determined whether having COVID-19 actually provides immunity, or if people can get sick with the disease more than once, and what impact that would have on lifting confinement and physical distancing measures? Thanks a lot.
I can begin and Maria can supplement. Certainly during the course of any individual illness, patients may, their clinical status may change during the course of the illness. The initial response to the virus can generate very high fevers as the person fights the presence of the virus in the body, and sometimes can appear to get better, and some people might say the fever breaks. But in other situations, that process is set up in the lungs, and people can then develop a pneumonia, which then results in a further deterioration. Other patients may have other organ failures that cause them to further deteriorate. Underlying conditions may come into play. So a patient's clinical status during the course of an illness can change right the way through the illness, depending on what is dominating their symptoms at that time. The virus, the immune response to the virus, the situation of the lungs, and then other underlying conditions that may make things worse. So seeing variations during infection is not unusual. With regards to recovery and then reinfection, I believe we do not have the answers to that. That is an unknown. One would expect that a person who generates a full-blown immune response with detectable antibodies should have protection for a period of time. We just don't know what that period of time is. We would expect that to be a reasonable period of protection, but it is very difficult to say that with a new virus, and we can only extrapolate from other coronaviruses, and even that in there, the data is quite limited. Maria?
Yeah, so to add to that, so there is a limited amount of information that's coming out about the antibody response to people who have been infected. And what we really need to understand is, what does that response look like for somebody who had a mild infection, who had severe disease, who had critical disease, who recovered. There's a study that's recently come out from Shanghai. It's a preprint, so it's not peer-reviewed, that has looked at plasma in 175 recovered patients. And that found, some individuals had a strong antibody response. Whether that antibody response actually means immunity is a separate question. That's something that we really need to better understand, is what does that antibody response look like in terms of immunity. In that same study, they found some patients who had no detectable antibody response, and they found some individuals who had a very high response. So right now the information is mixed. We need much more information from recovered patients. There's more than 300,000 people globally who have recovered, and we really need to better understand what that antibody response is. There are a number of studies that are underway that are looking at the antibody response using different serologic tests that are currently available. Some of these are screening assays, and some of these require high BSL labs that could look at a neutralization assay. And so as soon as we have that information, we will share that with you. But right now, we don't have a full picture of what immunity looks like. And until we do, we can't give a complete answer.
Thank you very much, Dr. Van Kerkhove and Dr. Ryan. Next question is coming from Michael Bosyurkiv, contributor to CNN. Michael, please.
Thank you. Can you hear me?
Yes, please go ahead.
Okay, thanks for the question and the correct pronunciation of my name. Dr. Tedros, greetings to you. Again, I go back to the criticisms from the White House last week, especially in regards to the early actions by WHO. President Trump, among others, by the way, said that WHO was late to the game, so to speak, especially on the declaration of human-to-human transmission. I'm wondering if you could address that criticism, and very quickly, if you could also, what would be the financial gut punch, if you will, if funding from the biggest donor will withdraw? And I think the world needs to know how badly this would affect the organization at this crucial time. Thank you very much.
So thank you for that question. I will start, and perhaps Dr. Tedros and Mike want to supplement with this. So with regards to the human-to-human transmission question, so right from the start, from the first notification that we received on the 31st of December, given that this was a cluster of pneumonia, I'm a MERS specialist, so my background is in coronaviruses and in influenza, so immediately thought, given that it's a respiratory pathogen, that of course there may be human-to-human transmission. So initially, when we started to put together our technical guidance for our member states, we put guidance that focused on how this virus could be transmitted. And what we focused on was droplet and contact transmission, which is how respiratory pathogens are spread. We also, within our infection prevention and control guidance, put out a special provision for healthcare workers who are focused on conducting aerosol generating procedures, in which we put in place recommendations for airborne transmission. That guidance is still in effect. The guidance that we put up was on the 10th of January. It was the 10th and the 11th of January because there were 5 or 6 technical guidance materials that were actually put up on the web, which were open to everyone. We also shared this guidance package, which included surveillance guidance on how to find cases, laboratory guidance on how to detect cases, infection prevention and control, how to prevent infections, particularly in healthcare settings, because given our past experience with MERS and with SARS, we immediately thought that you could have transmission in healthcare facilities, you could have amplification events in healthcare facilities, and potential super spreading events. I did a press briefing on January 14th where I mentioned this. And in fact, that got quite a few headlines because I think saying that we may have super spreading events is something that we worry about as an organization, and we want to do everything that we can to prevent that from happening. We also put out a readiness checklist at the time for countries to say, how are we prepared to deal with a pathogen, a respiratory pathogen, and what systems do we need to put in place? And we lastly put out a disease commodity package, which listed all of the materials that one may need to detect cases, to care for cases, given that we didn't have a treatment, we still don't yet, but to put out how can we symptomatically treat individuals. And so very early on, suspected that there would be human-to-human transmission because it's a respiratory pathogen. And so that's why our guidance on the 10th and the 11th of January included information on how to protect people from getting infected, focusing on respiratory and droplet transmission.
And I just may add, in terms of official information to our member states, on January the 5th, WHO published an alert to all our member states on the epidemic platform that we have, and on the same day published public information on that on January the 5th, and very prudently on January the 7th.
Korona, korona, korona. Korona var öpme, hastayım ben öpme. Bir selamın yeter, fazla ısrar etme. Öp, öp. There is Korona, don't kiss. I am ill, do not kiss. Greeting is enough. Do not insist too much. Don't kiss. Don't kiss. Korona, yakın temasta bulunmayalım. Sakın gitmesin kimsenin zoruna. مجنك نخوش مجنك سلاوك تبس بهنا منطقنك مجنك مجنك Korona, korona, korona, korona.
Korona, korona. Eyvah, eyvah. Korona, korona. Suya sabunum var, seni yeneceğim. Eyvah, eyvah. Bana yine gezmeleri zehir edeceksin. Korona, korona. Buna mecburum, ile seni sileceğim. Olmaz, ölmez. Zorlama ne yani, sabun mu yiyeceğim? Ne yapsam tatilde bomboş. Bir görsen halimi keşke. Kolonya bir mucize, çok sür. Atlatsam bir seni, oh oh. Çıkıyorum parka, geri çağırıyor anam. Arada bir hapşırıyor üzerime ama sakladım maskenin en güzelini sana. Dünya bir mola, sen bir yala. Sokak boş ama yine alır coş. Bu da gelip gider, hadi amacına koş. Yoksa su ve sabun alsana sır. Bulamazsan onu yalnızca sür. Kolonya, bol böyle sür kolonya. Atlatırsan çok korona, ama çok zor korona. Kurtar bizi Mevla. Korona, korona. Suyla sabunum var seni yeneceğim. Eyvah, eyvah, bana yine gezmeleri zehir edeceksin. Korona, korona, buna mecburum yine seni sileceğim. Olmaz, ölmez, zorlama ne yani sabununu yiyeceğim. Aa yok, ama bağışıklık geni zor. Sür kolonya, bol böyle sür kolonya. Atlatırsan çok korona, ama çok zor korona. Korona, korona. Eyvah, eyvah. Korona, korona. Suyla sabunum var seni yeneceğim. Eyvah, eyvah, bana yine gezmeleri zehir edeceksin. Korona, korona, buna mecburum ile seni sileceğim. Olmaz, ölmez, zorlamayla yani sabun mu yiyeceğim?
Bize kadar geldi kapımızda korona. Mahkum olmadık biz maskelere korona. Küçük maske elde koydum onu kenara. Kapımıza kadar dayandı bu korona. Kapımıza kadar dayandı bu korona. Kapımıza kadar dayandı bu korona. Arabada buldum attım sonra kenara. Koku saldı baktım sarstı beni kerata. Mamacita muy bonita dime merhaba. Gel anam virüsü de ver ona. Salla sana. Ve vişardi zıpla benle hastalara. Çalkalaya. Attım virüsü havaya sen yakala. Touchdown İstanbul. Shutdown mami arabada carpool. Sonu yok bu gecenin. Koskoca Wuhan beğenim. Bize kadar geldi kapımızda korona. Mahkum olmadık biz maskelere korona. Küçük maske elde koydum onu kenara. Kapımıza kadar dayandı bu korona. Kapımıza kadar dayandı bu korona. Kapımıza kadar dayandı bu korona. Bize kadar geldi kapımızda korona. Mahkum olmadık biz maskelere korona. Küçük maske elde koydum onu kenara. Kapımıza kadar dayandı bu korona. Kapımıza kadar dayandı bu korona. Kapımıza kadar dayandı bu korona. Kapımıza kadar dayandı bu korona. Kapımıza kadar dayandı bu korona.
İşte bir sabah uyandığımda her yanım korona, korona, korona. Haydi giriyoruz karantinalara. Her yanıma ah kolonya. Şimdi bir yavşak yarasa yedi. Yarasa yenir mi, yenir mi, yenir mi? Makarnayı yedin, fasulyeyi yedin. Ulan yarasa yenir mi? Bahar ayları evde oturmak reva mı lan bana, lan bana, lan bana? İşsiz kaldı millet, güçsüz kaldı millet. Ulan Çin'deki pezevenk. Ulan Çin'deki pezevenk. İşte bir sabah uyandığımda her yanım korona, korona, korona. Haydi giriyoruz karantinalara. Her yanıma ah kolonya. Şimdi bir yavşak yarasa yedi. Yarasa yenir mi yenir mi yenir mi? Makarnayı yedin, fasulyeyi yedin. Ulan yarasa yenir mi? Bahar ayları evde oturmak reva mı lan bana, lan bana, lan bana? İşsiz kaldı millet, güçsüz kaldı millet. Ulan Çin'deki pezevenk. Benk, benk, benk, benk, benk, benk, benk, benk, benk. Ulan Çin'deki pezevenk. İşte bir sabah uyandığımda her yanım korona, korona, korona. Haydi giriyoruz karantinalara, her yanıma ah kolonya. Şimdi bir yavşak yarasa yedi. Yarasa yenir mi yenir mi yenir mi? Makarnayı yedin, fasulyeyi yedin. Ulan yarasa yenir mi? Bahar ayları evde oturmak reva mı lan bana, lan bana, lan bana? İşsiz kaldı millet, güçsüz kaldı millet. Ulan Çin'deki pezevenk. Benk, benk, benk, benk, benk, benk, benk, benk, benk. Ulan Çin'deki pezevenk.
Vamos a buscar esto. Andamos ruleta en una camioneta, recogimos la vaina que llegó la avioneta. Andamos ruleta en una camioneta, recogimos la vaina que llegó la avioneta. Coronao, coronao, coronao, nao, nao, coronao, coronao, coronao, nao, nao, coronao, coronao, coronao, nao, nao, coronao, coronao, coronao. Andamos ruleta en una camioneta, recogimos la vaina que llegó la avioneta. Andamos ruleta en una camioneta, recogimos la vaina que llegó la avioneta. Coronao, coronao, coronao, nao, nao, coronao, coronao, coronao, nao, nao, coronao, coronao, coronao, nao, nao, coronao, coronao, coronao, nao. Yo soy el único en Dominicana con todos los contactos. Yo controlo los manitos como que un lacto. Todos los bloques en Paraguay, picante, calentón, matón. Coge los batoncitos con vale un botón. Gente de la vía, que sonate por dinero. Yo te presenté la conita, volví impuesto. Tú no estás mirando que los cuentos los botamos. La leche la botamos. La maleta y los bultos, llénalo de falto, llénalo de falto, llénalo de falto. La maleta y los bultos, llénalo de falto, llénalo de falto, llénalo de falto. La maleta y los bultos, llénalo de falto, llénalo de falto, llénalo de falto. La maleta y los bultos, llénalo de falto, llénalo de falto. Andamos ruleta en una camioneta, recogimos la vaina que llegó la avioneta. Andamos ruleta en una camioneta, recogimos la vaina que llegó la avioneta. Coronao, coronao, coronao, nao, nao, coronao, coronao, coronao, nao, nao, coronao, coronao, coronao, nao, nao, coronao, coronao, coronao, nao, nao, coronao, coronao, coronao, nao, nao, coronao, coronao, se lo meto por del lado. Yeah, she fucking for the club, bust a nut in her mouth, and I'm out, out, out. 50 hoes down south, no, don't eat, smell it, beat out. Coronao, coronao, coronao, nao, nao, coronao, coronao, coronao, nao, nao, coronao, coronao, coronao, nao, nao, coronao, coronao, coronao, nao, nao, coronao, coronao, se lo meto por del lado. Yeah, she fucking for the club, bust a nut in her mouth, and I'm out, out, out. 50 hoes down south, no, don't eat, smell it, beat out.
Welcome to Jagan.
Eating quesadilla fucking on his baby mama. Ooh, ran out of drugs through the plug from Uganda. Street nigga, I bust his head for $40. Street nigga, I fuck a bitch in no condom. Ooh, hot boy, yeah, I'm real hot like a sock. For the street nigga, I bust his head for $40.
Los pilotos aterrizan, vamos a buscar esto. Andamos ruleta en una camioneta, recogimos la vaina que llegó la avioneta. Andamos ruleta en una camioneta, recogimos la vaina que llegó la avioneta. Coronao, coronao, coronao, nao, nao, coronao, coronao, coronao, nao, nao, coronao, coronao, coronao, nao, nao, coronao, coronao, coronao, nao. Andamos ruleta en una camioneta, recogimos la vaina que llegó la avioneta. Andamos ruleta en una camioneta, recogimos la vaina que llegó la avioneta. sonaste por dinero. Yo te presenté la conita, volví impuesto. Tú no estás mirando que los vueltos lo botamos, la leche la botamos. La maleta y los bultos, llénalo de falto, llénalo de falto, llénalo de falto. La maleta y los bultos, llénalo de falto, llénalo de falto, llénalo de falto. La maleta y los bultos, llénalo de falto, llénalo de falto, llénalo de falto. La maleta y los bultos, llénalo de falto, llénalo de falto. Bajo ruleta en una camioneta, recogimos la vaina que llegó la avioneta. Bajo ruleta en una camioneta, recogimos la vaina que llegó la avioneta. Coronao, coronao, coronao, coronao, coronao, coronao, coronao, coronao, coronao, coronao, coronao, coronao, coronao,
Coronao, se lo meto por del lado. Yeah, she fucking for the clout, bustin' that in her mouth, out, out. 50 hoes down south, no, don't eat, smell it, beat out.
Coronao, coronao, coronao, coronao, coronao, coronao, coronao, coronao, coronao, coronao, coronao,
Coronao, se lo meto por del lado. Yeah, she fucking for the clout, bustin' that in her mouth, out. 50 hoes down south, no, don't eat, smell it, beat out.
Welcome to Jagan.
Ran out of drugs through the plug from Uganda.
This
Street nigga,
is
I busted
Money
$40.
Reef.
Street nigga, I fuck a bitch and no condom. Ooh, boy, yeah, I'm real hot like a sock. On street nigga, I busted $40. Street nigga, I fuck a bitch and no condom. Ooh, street nigga, I busted
y los bultos, llénalo de falto.
Money Reef.
Visita en el infierno. Mira en el centro de mis ojos. ¿Tú conoces el diablo? Soy el diablo. ¡Diablo!
benim de tanrım.
Ne desem yaparlar mı?
Yaparlar.
Öyleyse bağırın ulan Fenerbahçe çok yaşa diye.